Welcome. In this program, we will provide practical guidance on how to optimally communicate the importance of annual influenza vaccination to your patients aged 65 years and older, especially as this disease presents significant health threats among this specific population. We will also emphasize some of the lesser-known but serious complications that can follow an influenza infection and why it is crucial to get vaccinated each year. Influenza is widely recognized as a leading cause of hospitalization and death among adults aged 65 years and older. But what's talked about far less are the long-term impacts influenza can have on their overall health, such as increased frailty, loss of independence, and worsening of pre-existing chronic conditions. Of added significance, influenza infection can even trigger or exacerbate cardiovascular or cerebrovascular events. This program will delve deeper into why these risks matter, how to talk about them effectively with your patients aged 65 years and older, and ultimately, how you can encourage your patients to help protect themselves against influenza by getting vaccinated. Influenza, commonly known as the flu, is a highly contagious respiratory infection that can lead to serious illness or even life-threatening outcomes. Common symptoms of the flu include fever, sore throat, fatigue, sneezing, coughing, watery eyes, nausea, vomiting, and muscle aches. While most people will recover within 7 to 10 days, others are at greater risk for experiencing severe complications, such as trouble breathing and pneumonia, which may lead to hospitalization or, in the most severe cases, can be fatal. As adults age, their immune systems naturally weaken, which makes older adults more vulnerable to serious complications from the flu. On top of that, many people 65 and older are already living with chronic conditions like diabetes, heart disease, or COPD, conditions that can significantly raise their risk of severe influenza infection. Additionally, the inflammation caused by influenza can trigger heart attacks and strokes. In older adults, influenza doesn't always look the way we expect. The classic symptoms like fever, cough, fatigue, and muscle aches can be subtle. Instead, older patients might show signs like confusion, delirium, or just a general sense of weakness. These atypical symptoms can easily be missed or mistaken for something else, which delays diagnosis and treatment, and that can lead to worse outcomes. But the real concern isn't just the flu itself, it's the long-term toll it can take on an older adult's physical and mental health. Influenza can lead to a loss of independence, even after the infection has passed. In recent years, influenza vaccine uptake among adults aged 65 years and older has averaged around 70% in Canada. While this is the highest uptake rate among adult age groups compared to adults aged 18 to 64, there remains a significant portion of older adults who are not getting vaccinated. Improved education on the importance of the influenza vaccine is essential to help increase coverage in this high-risk population. One way of increasing flu vaccination coverage is by discussing the effectiveness and safety of the influenza vaccine with patients. Regarding safety, it is important to reassure patients that flu vaccines have been used in Canada for years and have a good safety profile. Influenza vaccines are rigorously tested to demonstrate they are safe for use. Only vaccines that meet the highest standards set out by Health Canada are approved for use, and approved vaccines are continually monitored to ensure their safety. It should also be stressed that serious reactions to the flu vaccine are rare. When it comes to effectiveness, a common myth persists that the annual influenza vaccine doesn't work, but this is far from the truth. It's important to reassure patients that the flu vaccine is updated each year to target the strains expected to be most prevalent. Enhanced vaccines, such as high-dose and adjuvanted options, are available to and specifically created for adults 65 and older to help strengthen their immune response to the vaccine. According to the 2025-2026 NACI recommendations, adults 65 years of age and older should receive either the high-dose, adjuvanted, or recombinant influenza vaccine, as these tend to better protect against flu infection in this age group than the standard dose influenza vaccine. If the vaccines recommended for this age group are unavailable, you can administer any other age-appropriate influenza vaccine. It is also important to inform patients that while the flu vaccine may not always prevent infection entirely, especially in years where there is a mismatch, studies consistently show that it significantly reduces the risk of severe illness, complications, hospitalization, and death. If patients ask about potential mismatches between the strains covered in the vaccine and the strains circulating, reassure them that if there is a mismatch, they will still get good protection against severe infection. Hospitalization and death are commonly cited consequences of contracting influenza. However, other lesser-known complications are often not mentioned by healthcare providers when promoting the flu vaccine, particularly to adults aged 65 years and older. Highlighting that these potential consequences of influenza are far more serious than the mild, temporary side effects of the vaccine can help build confidence and encourage greater vaccine uptake among adults in this age group. One of the most insidious complications of influenza in older adults is the worsening of frailty. A single episode of influenza can significantly impair muscle strength, balance, and overall functional capacity, potentially resulting in a temporary or permanent loss of independence. This decline can severely impact the ability to carry out daily activities and can increase reliance on caregivers and/or lead to long-term disability. For healthcare providers, this is a critical message when discussing the benefits of vaccination. Preventing influenza helps maintain independence, preserve physical strength, and reduce the risk of permanent functional decline. As healthcare providers, we know that by vaccinating our patients, we are not only helping to prevent influenza, we are also supporting their ability to maintain independence and avoid the debilitating effects of frailty that can follow infection. Vaccination has been shown to reduce hospitalizations, improve recovery outcomes, and lessen the risk of long-term functional decline often seen in older adults after the flu. When speaking with patients, frame vaccination as a proactive step toward preserving their mobility, independence, and overall quality of life. Influenza can significantly worsen pre-existing chronic conditions such as heart disease, chronic obstructive pulmonary disease, COPD, diabetes, and kidney disease. The physiological stress of a flu infection can trigger acute exacerbations, often leading to hospitalization, prolonged treatment, or even a permanent decline in health. For instance, a severe respiratory infection can intensify COPD symptoms, while flu-induced inflammation and fever may disrupt blood sugar control in patients with diabetes. For patients with chronic conditions, influenza is more than just a seasonal illness. It can be a serious health threat. Healthcare providers should emphasize that vaccination not only reduces the risk of contracting the flu, but also lowers the likelihood of complications such as heart attacks, strokes, and disease flare-ups. By getting vaccinated, patients can protect themselves against hospitalizations, avoid invasive treatments, and maintain better control over their chronic illnesses. One of the most concerning and often underappreciated consequences of influenza in older adults is its ability to trigger cardiovascular and cerebrovascular events. Research shows that the inflammatory and physiological stress caused by influenza increases the risk of acute cardiac events, including heart attacks and arrhythmias. In fact, some studies have found that the risk of heart attack can remain elevated for weeks following recovery from influenza infection. Similarly, influenza is linked to a higher incidence of stroke, particularly in older adults with existing risk factors such as hypertension or a history of transient ischemic attacks, TIAs. Healthcare providers should emphasize that flu vaccination is not only important for preventing influenza infection, but also plays a critical role in reducing the risk of these serious secondary complications. Cardiovascular and cerebrovascular events remain leading causes of death and disability in older adults. By getting vaccinated, patients, especially those with a history of heart disease or stroke, can lower their risk of flu-related cardiac and neurological events. This makes vaccination a vital preventive measure in this population. There is significant value in taking the time to speak with your patients about the long-term benefits of influenza vaccination. As healthcare providers, we play a critical role as trusted sources of information, especially for older adults who often rely on us for guidance. We can help patients understand that flu vaccination is about more than just preventing seasonal illness. It is a powerful tool for protecting quality of life. Beyond reducing the risk of severe illness, hospitalization, and death, annual flu vaccination can help lower the likelihood of long-term complications, including the worsening of frailty, cardiovascular events, and the exacerbation of chronic conditions. Framing the flu vaccine is part of a comprehensive strategy to protect against both the immediate and lasting effects of influenza can be especially persuasive. Many older adults hesitate to get vaccinated due to misconceptions about the flu vaccine's effectiveness or concerns about side effects. It's essential to address these concerns by reassuring patients that flu vaccines are safe, well tolerated, and critically important in preventing serious complications. By highlighting the broader benefits, such as preserving independence, maintaining mobility, reducing the risk of heart attacks and strokes, and avoiding hospital stays, you can help motivate patients to make informed decisions about their health. In conclusion, educating patients about the long-term risks of influenza, responding to their concerns with evidence-based information, and recommending annual vaccination are essential actions. These conversations can directly contribute to improved health outcomes and a better quality of life for older adults.